Hi, I'm Steve Adubato. On this program, we recognize people who make a difference in the lives of others. We are honored to be joined by Emma Joy, who is one of the co-founders, together with her sister Quinn, of an organization called Girls Helping Girls, period. And she is one of the 2021 Russ Berrie Making a Difference honorees. Emma, so good to see you.
Good to see you too, Steve.
Tell us exactly what the organization is, A, and B, why is this such an important subject?
Sure. So Girls Helping Girls, period, is a nonprofit organization that raises funds and donates menstrual products to period users who are in need of help. And the reason that this is such a very important topic and educational issue is because it's not talked about a lot. When we first found out about this issue, there was almost no research, no work being done on the matter. And slowly over time, people have realized that this is something that is very important and it is a necessary need in the lives of people who can't afford to have these products. And we think that menstrual products are a basic right for menstruators, and we hope that other people do as well. So our mission is just getting the word out there about why this is an important matter and educating others on what they can do to help people in their community.
Well, first of all, Emma, you and your sister Quinn are to be not just recognized and honored, but you're a role model for others. And as we put up the website for the Russ Berrie Foundation, nominate someone, recognize someone who is making a difference. We have been part of this. I've been hosting that event for well over 20 years, and I've met some extraordinary people. But one of the things that strikes me about you and your sister Quinn for doing this is you started this. Give me the ages again, Emma. How old were you? Is it 12 and 15?
It is. It is 12 and 15, yes.
What triggered it?
Yeah. At the time, I was also working on another volunteer initiative. Our mom sort of instilled in us always to give back to other people from the time we were very young. We were always doing volunteer work with her. And I was working on a food can drive for my synagogue. And in doing this, I was brought to light this issue by a news reporter that was doing a short story on us for our local newspaper. And she told us, did you know that food stamps in America don't cover menstrual products? And that kind of got the wheels turning. So we started to do some more research, and we realized that the bigger issue is that there are menstruators who are missing school and work because of their periods. They don't have the necessary products they need to go to school and take care of this normal bodily function in a proper way. And so they just skip, or in some cases, they don't have like a tampon or pad when they need it. So they spend a lot of time going to the school nurse, going to the social worker, asking friends. In all honesty, they should just be free and readily available in public bathrooms. So that's kind of what started it. And then just learning more and more through other people who did know about the issue, which in 2015 wasn't a lot of people. So we then had a collection where we asked all of our friends and family to bring us products, and everyone, of course, wanted to learn more. So we took it upon ourselves to keep this going. And a year later, Girls Helping Girls, period, was founded.
Emma, let me ask you something. First of all, I'm just struck by this because so many of us, I want to say this the right way, parents, and I don't know if it's disproportionately fathers. I'm not sure about this. I just know that we have a daughter, a young daughter, and I'm thinking how challenging it is, and it shouldn't be for me. And my wife and I talk about how to deal with this. It's not about us, but I'm sitting there going, for just a family that has the means, that is comfortable, it's challenging enough to make sure the young woman understands, feels confidence, deals with this in the healthiest way from an emotional, mental, and physical health perspective. But now you're talking about economically disadvantaged in communities that are disproportionately Black and brown and struggling. It's that much more challenging and difficult, is it not, Emma?
It absolutely is. For sure, we see that in a lot of communities that are more economically disadvantaged, this isn't even a topic of conversation. They don't have any supplies necessary in their schools or in their places of work.
1 second, I'm sorry for interrupting. Should schools be doing more? And if so, what is that exactly?
Absolutely. Our shift in the last 2 years has been on prioritizing schools and pushing schools to bring it upon themselves to take care of their issue. In a perfect world, we don't have to do anything. We shouldn't have to help anyone because schools and other public administrations are taking it upon themselves to provide products to people that they care about. If schools want to care about their students, these products should be free and readily available in their bathrooms. And so while we still, of course, donate supplies to all of those organizations, a big shift in our mindset has been educating school boards, school nurses, social workers to do the work so that they show that they care about their students.
So, I mean, let me just tell you this. I'm a student of leadership, and you are the embodiment of a leader at any age and making a difference in the lives of others. And as we put up the website one more time, I believe that there are 24 unsung heroes that are being recognized by the Russ Berrie Foundation with the Making a Difference Awards. In this last minute we have, let me ask you this. How would you describe, or what would you describe drives you and your, dare I say, passion for doing this work?
That's a great question. I think what drives me is knowing that there's always going to be something to do to make a difference in my community. And I'm a very fortunate person. I grew up with all of the things that I needed to be successful, but I know that there are a lot of things that I needed to get myself there. And there are a lot of people going through the education system in this country that don't have those things that I have. And so education to me is number one important thing. And if someone can have more things that they need, like menstrual products, to make them more successful in their education, that's what drives me to work on this.
Hey, Emma, you just made a significant difference in the 7 or 8 minutes you were on the air with us. I cannot thank you enough. Also, thank your sister Quinn for us and your entire family, and we appreciate you joining us. Thank you so much, Emma.
Thank you, Steve.
That's a leader right there. We'll be right back after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berrie Foundation, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, the Turrell Fund, supporting Reimagine Childcare, the New Jersey Education Association, Holy Name, the Port Authority of New York and New Jersey, Georgian Court University, and by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber and by NJ Biz.
Hello, I'm Dr. Luke Ironman, a family medicine specialist at Holy Name. When was your last visit to your primary care doctor? Throughout the pandemic, many patients have put off their annual physicals and screenings, but preventative healthcare is critical for early detection of illnesses and to avoid future health problems. Your doctor can also help you develop a wellness plan to achieve your personal health goals. Your health can't wait. Be proactive and talk to your primary care doctor today about scheduling your annual physical.